we are doing a history. That is a 12-year-old girl to
Mm-hmm.
sudden become unconscious in her school. Okay,
Okay.
she is
Okay.
Ria, and her school people are taking her on the hospitals, and now you are taking the history.
Okay. What is the name? And I'm taking from mom.
No, no, you are taking from the child. She is a 12-year-old girl. She admitted yesterday because of loss of consciousness. Now she is fully fine, and now you're talking with Ria. Suppose she is a 15-year-old girl, okay, teenager.
Okay.
No, no, okay,
Okay.
mother, from mother you are taking mother. Mother is coming on the exam.
Okay.
Okay, mother is Salma.
Okay.
So you take time or you can start.
2 minutes. It's a 15 years or 12 years?
Okay, 12 years. You can take anything.
Okay.
You're taking
Okay.
from mother.
Okay. I can start. Good
Wait,
morning, Salma.
wait. I am to keep the time first. Okay, you can start now.
Good morning, Salma.
Good morning.
So this is Dr. Nida, one of the child doctor in this hospital, and I'm here to talk to you regarding Ria. So is it okay?
Yeah, it's okay.
Okay. If you don't mind, I would be writing some notes during our meeting. Okay.
Okay, okay.
So can you tell me, Salma, what actually happened with Ria last day in the school?
Actually, Ria was normal. She goes to the school yesterday very nicely. Sudden a call come from the school that she has lost her consciousness. So after hearing that, I go the school. Then I go to the hospital. She admitted the school people, and then she become okay. That is the main concern or problem.
Okay. So actually, do you actually know for how long she got fainted?
Actually, I don't know, but I heard with her friends that she was playing and suddenly she lost consciousness. They hold her, take inside the classroom, but she become okay. Few moments later she become okay. They tell me, but they take to the hospitals.
Okay. Okay. So for a few minutes she got fainted.
Mm.
Any particular thing she told to anyone before falling down?
No, nothing. She was just after playing, she was just coming. Their playing was over. Tiffin time was over. Uh,
Okay. 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 Was she sweating at that time?
Actually, it's a sunny day. She play on the outside. She liked to play, and she was playing with the friends. And after that, it's normal. She becomes sweat.
Okay. And did she had any injury while falling?
No, there is nothing. Maybe she become some hurt it herself. Otherwise, no any serious injury occur.
Okay. And while she fall down, she passed any pee or what
No,
happened
no,
when
not,
she fall down?
no, nothing. Nothing happened. She become okay.
Okay. So did she take any? She's on any medications?
No, she is not any medication.
Okay. So when was the last meal before this event?
Yeah, she was at the morning. She's very much picky, not want to eat, not want to. She takes some food and go to the school. She missed her breakfast meal.
Okay. Okay. So was the sugar was checked at the time of this event or in the hospital?
Yes, yes, they have checked it.
And what was that?
It was normal.
Okay. Um, is she having any chronic disease?
No, there is no any chronic disease.
Okay. And is she running fever in these days?
No.
Any concern with?
Just 20 days back, she have some loose motions.
Okay. Okay. And they are settled now?
Yeah, she's settled. 15 days back, settled. It was a simple gastroenteritis.
Okay. Any concern with her weight? She has
No, I
gained
have no
weight
any
or she has
concern.
lost?
No, no, I have no any
Okay.
concern.
Um, how is her activity these days? Is she less active or she's normal?
No, she is not good. She's very much active. You can say that. Always play, play, play mood.
O- Okay. And what about her sleep?
Sleep is okay.
Okay. So she complained of headache. She has any
No.
complaint of headache?
Yeah, it's sometime, sometimes she complain headache. But it's okay. I have no any concern. Normal headache.
Okay. Okay. Does she complain of any abnormal feeling while coming out of the bed,
No.
while standing from the sitting position? Does she feel any heart racing?
No, no, like not, she never tell me anything, you know.
Sometimes she feel darkness in front of the eyes.
Yeah, that what she lose the consciousness. She told shared that she become the playground was spinning around her head. She feels like that. It's moving.
Okay. Okay. And it was the first ever event, or has ever such event happened before?
Yeah, 6 months back, once she again become unconscious.
And what was done that time?
Nothing. She became okay. What happened? She stand from the sitting position sudden and she fall down. Then we keep her, and then she became okay. It will lasted like 1 minute type. 1 minute.
Okay. Okay. Any problem with her? She's any problem with her chest?
Uh, what do you mean by any problem in chest? No, I
Uh,
don't notice anything
uh,
in chest.
recurrent bugs in the chest.
Now,
Okay. Any problem with her pee?
no,
Any problem with her poo?
no, no, I don't find.
Okay. Any problem with the weather, like she's feeling very cold or hot?
No, but this time it is sunny day, so we are everyone feeling hot.
Okay. Okay. That is normal for all of us. Has she started with puberty, with menses?
Yeah, she's her on the way. It's not fully.
Okay. Okay. Um, um, any lumps in the body? Any swelling or lumps in the body?
No,
Any rash on the skin?
no,
Is she following any team?
no. She's a completely good girl. We are not following any
Uh,
team.
okay. Is she on any treatment?
No,
Is she allergic to anything?
no, she's not allergic to anything.
Okay. Yeah, has she ever been admitted?
Yeah, once when she was young, she was admitted because of bronchitis. It was a normal respiratory infections, chest infection.
Okay. Okay. Any operations done for her?
No,
Her delivery was normal. Any issues after delivery? Do you
no,
remember?
no, nothing, nothing. Just she delivered. Doctor discharges. We go to the hospitals. Oh, sorry, go to the home.
Okay. Okay. Her vaccinations are up to date.
Yes, she has taken all the vaccines.
Okay. Um, how is her diet? Can you tell me about that? What she eats in a day?
She's very picky. Sometimes she eats, sometimes she doesn't. It depends on the child are, very much disturbing. Like this morning, she has not eaten. Just only one glass of water she taken and go to the house school. Request her, eat,
Okay.
eat, eat. Like one or
Oh,
two she take, then bite, then she goes.
so does she feel anything particular about her body that she is very obese or something like that in her mind, body image?
No, no, nothing.
Okay. Okay. Does she have? I have to ask this as she's a school-going girl. Do you think she's in drugs or alcohol?
No, no. What type of question is that, my child? No, no. Of course not.
No, I'm sorry if you feel like that, but as a doctor, we have to ask some sensitive
Mm.
questions also. So,
Okay, 9 minutes.
okay, any special friend she's having?
I think maybe I don't know. Of course, she has some special friend, not boyfriend like.
Okay, okay. Um, do you think she's in smoking?
No, I don't know. I don't think like that.
Okay. Can you describe me your family?
Yeah, me and my child. I have another child. She is Lucy, another daughter. She's 5 years age old, and my husband. We're four people living together.
Okay. So, do you have any history of in family? You have any sudden death or something like that?
No, no, nothing.
Any history of any like people with with heart problems?
No,
Okay. Um, who is the earning member in your family?
my husband. He's an engineer.
Uh, okay. So, is there any problem with in maintaining finances?
No.
Okay. Tell me about her school. Is she how is she at school? Any stressor at the school?
Yeah, exam is going after 20 days. She is also preparing for exam. It's a midterm exam, not final.
Okay. She regular at school?
Yeah, she's regular. She's very much interested to go play. She always busy with playing.
Okay. Due to these events, has she ever missed the school?
Never.
Okay. Is the school nurse has been informed about her condition? Like it occurred 6 months back also. Is she
No,
aware of
nothing.
this?
Actually, we have not given any importance about that. We think it's okay. Maybe anything happened, she become lost. But this is second time occur. Now I need to talk.
Okay. Okay. So any concern which I haven't covered and you think I should know, you can tell me.
No, I don't know. You have that. What you want to ask? I think everything you ask.
Okay. Okay. So I have done how much time?
It's 2 minutes remain.
I don't know what to ask more.
Okay, okay. End this. Okay, I'm revising my note and I will come back to you.
Okay.
So, what is your
Vasovagal.
presentation and diagnosis? Please tell me.
So I think this is a type of a syncope, and it's maybe a vasovagal syncope or
No, no. Please
postural
present your
hypo.
case within 1 minute.
Okay, so I have taken notes from Salma, who is 12 years old mother, Ria. She has become unconscious in the school, and similar kind of event occurred 6 months back. This time, the cause maybe she was playing and didn't have enough amount of nutrition, but the sugar was normal, and she fainted for some time, and then she fully recovered from there. There are no red flags in the history regarding any sudden cardiac death or cardiac disease in the family, and there is no issue of uh, there is no issue of body image in the child as well, and the family and socioeconomy is fine. um, I haven't found any stressor for the child. So in my opinion, the case is a vasovagal syncope.
Hmm. Okay. So, this is a case of esophageal syncope. What is your DD?
My differentials would be um, postural orthostatic tachycardia syndrome, which is
Hmm.
also very common in this age, and
Hmm.
it may be a cardiogenic syncope. It may be a psychogenic syncope.
Hmm. And also hypoglycemia include because I give a history in the morning she has not taken the breakfast, right?
Yes, and even due to hypoglycemia, prolonged fasting and hypoglycemia.
Okay. So when someone telling that loss of consciousness like that, it is an acute history. It comes. We can rule out some DD first in our mind, like CVS causes, long QT syndrome, Wolf Parkinson. These are atrial fibrillation, CNS something, and drugs. She's taking any drugs or not, metabolic hypoglycemia, and non-cyanotic or vasovagal attack, postural hypertension, anaphylaxis, hypoglycemia. These are. So our
Hmm.
complaint was that child, you have missed the development history. Remember, you have not asked.
Yeah, yes, but I intentionally, I didn't. I mean, it's a 12 years old girl. Mother is not telling me. That's why I missed. But I should have asked.
No, one line, just is that she is talking, running, is that similar to her peers? Do you have any concern about her growing
Okay,
like that?
okay, okay.
Because every
Hmm.
domain need to touch.
Okay. Do
First
you
of all,
have any?
you have loss of consciousness. So when it started, how long it continue, and what make it better, what make it worse. And this time you will ask, it is it first time or recurrent occur? You ask on maybe systemic review or past history.
Yes,
You
yes,
forgot this
yes,
line, huh? First time or
yes,
recurrent, we will ask that. After
yes,
that, any history of like unconsciousness or epilepsy, anything before what she's doing, during and after. Before, like fever,
yes.
pain, anxiety, hunger, cough, pee, poo, recumbency, fear from any something in front of others or alone, sweating, blackouts, tinnitus, or hot weather. So I have given you history. She's playing like in the playground. It is a hot weather, and after that she sweats and she become lost consciousness and she become okay. So that is a hot weather, one of the cause of vasovagal attack. Okay. And
Hmm,
during
hmm,
what she is doing, any abnormal movement, blue lips, loss of control, fall in the ground. You just about she passing pee or not. So during what she is doing. And after that, you have not asked me after like weakness, any abnormal gait, confusion, any injury. You just ask about the
hmm,
trauma, injured. So any confusion very
hmm,
important and duration is very important because of differentiating. It is an epilepsy or any heart condition or any syncope. Syncope child are
hmm.
normal. They have no any negative history, no any red flags. And previous any similar attack and video recording if available or not. These are
Okay,
our
okay.
analyzing. After that, we ask about any other concern. I have any chronic conditions he is suffering, dysmorphic any features or not. Then we go about fever, weight, activity, sleep. Okay, how about a fever, weight, activity, sleep affected or not? Then about first we are going CVS. Do you ask heart racing, awareness of heartbeat, chest pain, exercise intolerance? Here CVS very important because cardiac is one of the cause, chest pain, exercise intolerance. Here she is exercise intolerance occur because she played lots of time. Then CNS like sign of an increase in pressure, headache. Yes, I have tell you that headache, but you need to ask is that headache is morning time headache, any morning
Yes.
vomiting with the headache. Okay, that is important. This is second time occur. So brain tumor, we keep it. We need to exclude when this complaint occur. Any abnormal movement, any trauma, any CNS infection. Then psychiatry, you can ask like any depression, anxiety, visual or auditory hallucinations, suicidal attempt. But it is important. I have given an information that her exam is after 20 days. So that is the anxiety. Chest, you ask recurrent back cough, how many pillows used for sleep, GIT, poo, tummy size, tummy pain, normal. P, blood pressure, blood glucose. You have not asked me blood pressure. Blood pressure also very important
Yes.
because postural hypertension is
Yes.
also one of our DD. Blood glucose you ask, it is very important. Endocrine you ask, hot weather, numbness, MSK, skin spots, labs, neck swelling, bone pain, hair loss. Hematology, pale platform. These are not needed. Actually, the point we need, we will ask. Then past history, 5T IOA, like any trauma, any traveling history, any treatment, what happened at home, drugs taken for any disease. These are puberty you ask, but you have to exclude the puberty. I have tell that puberty is on the way. You need to ask about menstruation. Is it regular? What is our last regular menstruation? Very important because she can be
Okay.
pregnant.
Yes.
Okay,
Yes.
because
Yes.
I don't know,
Yes.
mother can't know. You need to. You have 1 minute remain for that. Two or three questions you have missed. And in puberty,
Okay.
you can perinatal history you ask, birth history as usual, allergy history as usual, development here as usual, nutrition important because you need to exclude hypoglycemia, you need to exclude the anorexia nervosa. Okay, so
Yes.
you exclude anorexia nervosa, hypoglycemia, both you exclude. Development after
Mm-hmm.
that, family is very important. Family, social, psychological, three parts. Family, you can ask how many members, describe your family please. So here one can be divorce, this can be a reason, psychological stress giving the child. So here it is a normal family. Sudden death in the family, it's very important you ask. Similar condition, any hearing, any family history of deafness because of long QT syndrome. And
Okay.
very important, social and psychological. Social, you need to ask, if you don't mind, I have to ask some question like in this age, child are experiencing new things. First of all, she's taking, do you think any smoking, drugs? Number one. Number two, anyone special in her friend? Do you think she does not want to live in this world like that? Suicidal attempt, everything you are asking. The psychological, you have not asked the how this disease affect her, how does it affect you, and her school activity. How is her? You ask school activity. These are. So this is the history. So our first diagnosis, vasovagal syncope. What is the vasovagal syncope? It is a temporary loss of consciousness tone that occurs as a result of inadequate cerebral perfusion. So it is a temporary loss of consciousness. What are the causes? Can be predisposing factor and what we search: warm environment, crowded space, anxiety or sudden surprise, fright, blood drawing or sight of blood, prolonged or motionless standing or upright sitting, lack of sleep, dehydration, hunger, any painful or unpleasant stimuli such trauma, severe menstrual cramps. So these are the cause of vasovagal syncope when we keep in mind. And about management, they will ask you what is the management plan for this child. First of all, in management from the NICE guideline, we exclude the red flags in our mind. So red flag are, is this syncope associated with swimming, chest pain, supine position, loud noise, palpitations, known any congenital or any acquired heart disease. Then family history, sudden death, age less than 40, inherited cardiac condition in the family, conduction disorders, early ischemic heart disease, age less than 30. And other characteristic like absence of paroxysmal symptoms and injury can be common. So these are the red flag we keep in your mind. Management, how can I manage this patient? First of all, I detail the history already taken. I will examine the child. Baseline observe, examine her, vitals, heart rate, blood pressures, blood glucose, and in orthopedic hypotension, what happened? That is measure the heart rate, blood pressure in lying position, supine more than equal to 10 minutes, and standing position at 3 minutes, 5 minutes, and 10 minutes without movement. Perform 12 lead ECG. Okay, we do the ECG in all patient. Uh,
Yes.
then ECG, we do the rate, rhythm, evidence of pre-excitation, heart block, and ventricular hypertrophy, QTC interval. So mainly vital sign, and I will do the ECG investigation. Examination, investigation, yes. Then management purpose, it is a vasovagal support. So vasovagal syncope, orthostatic intolerance group with normal examination, normal to every ECG, reassurance, and lifestyle advice we give. What is the lifestyle advice? Avoid dehydrations, avoid extreme heat, increase fluid and salt intake in the diet. Okay,
Hmm.
so this is all about our syncope history. I think this will they ask. Thank you very much for your participations.